in the MRI.
Okay, thanks.
Thank you very much.
Thank you.
And now for a speaker who needs no introduction, because there's nobody to introduce me. Do you start this, or do I? Thanks. So what I'm going to be talking about is some of the recent work that our lab has been doing, looking at the stress-induced activity and how it impacts the dopaminergic system through actions within the hippocampus. And I have my disclosures here. So we know that the dopamine system has a well-known role in schizophrenia pathology. However, despite a lot of research, there's not a lot of evidence for a change in the dopaminergic system itself. Instead, we believe that the dopamine system is probably normal, but is dysregulated by other structures, and in particular, we've been focusing on the hippocampus. There's a lot of evidence, both from our MAM model, which is a developmental disruption model in rodents, and in schizophrenia patients, that there's a hyperactivity within the limbic area of the hippocampus, which is the ventral hippocampus of the rat or the anterior hippocampus in humans. Now, why is the hippocampus hyperactive in schizophrenia models? Well, one thing that's been repeatedly shown is a loss of parvalbumin interneurons, which is a type of GABAergic interneuron. There's a loss both in the prefrontal cortex and in the ventral hippocampus in rats that's also consistent with what's been seen in human schizophrenia patients. So the MAM rats show this regionally selective reduction in parvalbumin interneuron number. Now, what causes the loss of parvalbumin interneurons? Well, parvalbumin interneurons are sensitive to a number of things, oxidative stress and also stress in general. In fact, there's a lot of evidence that stressful stimuli impact schizophrenia, both in terms of exacerbating the positive symptoms of psychosis, but also studies by Eve Johnstone and also Robin Murray, who showed that if you look at children that are at genetic risk for schizophrenia and put them through a number of psychometric tests, you find that the children that are hyper-responsive to stress tend to be the children that eventually go on to develop schizophrenia. And the thing about stress is it's known to cause a loss of parvalbumin interneurons in the hippocampus, which are the same interneurons that are lost in schizophrenia patients as well as in our MAM rats. Now, if these children are hyper-responsive to stress, do we have evidence that MAM-treated rats are also more anxious and sensitive to stressors premorbidly, as is proposed to occur in schizophrenia? Well, what we find when we look at several measures, the elevated plus maze, which tells just how anxious the rats are, whether they explore the maze or whether they hide in the clothes arm, show that MAM rats are more anxious, and this is pre-pubertally, before we start to see any of the dopaminergic changes. We find that if we look at response to stress, in this case foot shock-induced vocalizations, the MAM rats show much more vocalizations both in duration and in number in response to a foot shock compared to control animals. And also if we look at the activity in the amygdala, an area that's associated with anxiety, even without any intervention, in the MAM rats, the amygdala is firing significantly faster than it is in the saline control rats. And again, this is all before puberty. So converging evidence from clinical and basic science studies suggests the inability to regulate stress early in life can lead to pathological changes in the hippocampus that we think can underlie some of the emergence of schizophrenia that occurs later in life. Now, what we found previously is if we actually intervene and control stress pre-pubertally by giving these animals diazepam, we can actually prevent the changes that eventually lead to schizophrenia in the schizophrenia-like symptoms in the adult rat, as far as changes in dopaminergic neuron firing, changes in cognitive function like novel object recognition and things like that. What's interesting is this suggests that the MAM and potentially genetic predisposition doesn't cause schizophrenia, but what it's causing is a hyperresponsivity to environmental stressors, and it's the environmental stressors that eventually go on to lead to the pathology. Now, if this is true, one would expect that if you stress an animal enough during this prepubertal state, you should be able to get the same kind of pathology. So what we did is to expose rats at this prepubertal period, postnatal day 31 to 40, to either 3 sessions of restraint stress, 10 sessions of foot shock stress, or combined foot shock and restraint. We then waited until they reached early adulthood and did our behavioral tests and dopaminergic neuron recordings. And what we found is that in these rats, either measured 1 to 2 weeks after stress when they're still in the juvenile state, or when they reach adulthood, the hippocampus is already hyperactive, just like we see in the MAM adult rats. So exposing them just to this 10 days of stress prepubertally is enough to activate the ventral hippocampus. When we look at amphetamine-induced locomotion, what we find are only rats that have been exposed to the combined stressors show the increased amphetamine-induced locomotion. And what we find is that this also correlates with an activation of dopaminergic neuron firing. What's interesting is when we look at which population of dopaminergic neurons are actually affected, the biggest effect we see when we divide the VTA into the medial, central, lateral is in the lateral VTA. Now, why is this important? Well, the medial VTA projects to the ventral medial striatum, and that tends to be involved in reward and affective processes. But the lateral VTA projects to the associative striatum, and the associative striatum are areas that Oliver Howes and Philip McGuire show an increased activation of fluorodopa uptake that correlates with schizophrenia, and Anissa Aboudargham and Mark Laruelle show an increase in amphetamine-induced raclopride displacement that correlates with psychosis and schizophrenia. So what we're seeing here is a selective activation in the dopaminergic neurons that we think are associated with the schizophrenia pathology. Now, stress, of course, leads to a number of things. One is oxidative stress, which we've heard a lot about, which Kim Do has been telling us about for decades, which the field has finally caught up with. It also activates the basolateral amygdala. And these two together are going to lead to parvalbumin interneuron loss, activation of the ventral hippocampus, and increased dopaminergic neuron activity. But one thing that helps to control stress is the medial prefrontal cortex, especially the prelimbic cortex in the rat or area 32 in the humans. This suppresses amygdala responses to stress. What happens if we interrupt this process? Well, what we did is to cause a prefrontal cortical lesion 5 days before we did the prepubertal stress. Now, the prefrontal cortical lesion itself is enough to make the animals anxious as far as behavior in the elevated plus maze. And after making these rats anxious, now foot shock alone, something that was not sufficient to cause the pathology in the adult, is more than sufficient to cause an increase in amphetamine-induced locomotion and an activation of dopaminergic neuron firing. And now it's occurring in several different areas, both the medial and the lateral VTA, suggesting we're getting both an affective component as well as what we think is something that's going to be more related to psychosis. Now, what about if we expose the animals to stress during adulthood? Well, if we give them both a foot shock and restraint stress, the combined stress that can cause the pathology in the juvenile rats, if we do this at early adulthood and measure either 1 to 2 weeks or 5 to 6 weeks after the stress, 5 to 6 weeks we don't see a change, but 1 to 2 weeks we do see a decrease. And in fact, this decrease is consistent with what we see in animal models of depression, suggesting that whenever you do this combined stressors in the adult, you tend to get depression rather than getting schizophrenia, which is consistent with schizophrenia and depression running in families. Now, can we make adults vulnerable to these impacts of stress? Well, one thing that we think is happening in the prepubertal period is that the parvalbumin neurons are more susceptible to the deleterious effects of stress because at this period they haven't formed the perineuronal nets. And the perineuronal nets, of course, lock the system as far as plasticity, but also protect the neurons. But we know that this critical period can be reopened by a number of different interventions. And one of them is by giving a HDAC inhibitor, histone deacetylase. By giving a histone deacetylase inhibitor, we can reopen the critical period. something that Takao Hench has shown very nicely in his plenary lecture, and also that's been shown in a number of different prominent papers that he's published in the visual cortex. So what we did is to give the HDAC inhibitor valproic acid starting at postnatal day 60, young adulthood, and then gave the combined stressors for 10 days at postnatal day 65 to 75. And what we found is that in contrast to the rats that were given saline, where you get a decrease in the number of dopaminergic neurons firing, animals treated with valproic acid and given the same stressors now show the same kind of increase in dopaminergic neuron firing that we see in the MAM-treated animals and the animals that were given the stress prepubertally. So therefore, the deleterious impact of stress, combined with factors predisposing an individual to the impact of stress, we think can underlie the susceptibility to schizophrenia. And this is critically dependent on the timing of the stress. If the exposure occurs during adolescence, so in humans maybe at 10 to 15-year age range, the parvalbumin neurons aren't protected. We get parvalbumin interneuron loss and the emergence of schizophrenia. But on the other hand, if the exposure to the stressors happen during adulthood, parvalbumin neurons are protected, and instead we get a condition that's more like depression. The increased response to stress, therefore, may be mediated by a failure of the medial prefrontal cortex, among other potential factors, to limit the impact of stress exposure. Now, what this suggests is we can identify susceptible individuals and intervene early enough, we may be able to prevent the deleterious effects of stress and hopefully prevent the transition to schizophrenia later in life. I want to thank all the people who were involved in this work, and thank you for your attention, and I'll be glad to answer any questions.